Reform TIMISCT Percutaneous Pedicle Screw System Surgical Tech Guide Video. 1. Skin incision. Advance the access needle into the pedicle. Once placed, remove the inner trocar needle and replace it with a guide wire. Make sure the blade on the tissue splitter is assembled. The blade is threaded on using the gold knob. Once assembled, slide the tissue splitter over the wire. This will create an incision large enough to pass the pedicle screw. Pedicle preparation. Serial dilation is accomplished by placing an 8 mm dilator, 13 mm dilator, and 18 mm dilator sequentially over the wire. Make sure the dilators are in contact with the bone. This will make your measurements during the tapping step more accurate. You can then remove the 8 mm dilator and tap through the 13 mm dilator. Note the laser markings on the side of the tap. These indicate the tap depth. Dilation Option 2 is accomplished with the tap dilator. Secure the tap dilator to the tap by slowly sliding the tap dilator over the tap until you hear and feel a click. Now place the tap over the guide wire. Once in contact with the bone, click the button on the side of the tap dilator and begin tapping. Pressing this button allows the sleeve to move up while the tap advances into the pedicle. Use fluoroscopy to ensure the guide wire doesn't advance while tapping. Lastly, remove the 13 mm dilator to prepare for pedicle screw delivery. Extended tab tulip and screw attachment. Assemble the screw by pressing the tulip onto the shank using your hands. Be sure to tug on the shank and tulip to confirm a snug fit. Do not snap the tulip onto the shank while it's still in the caddy. This can cause improper mating of the tulip and shank, resulting in separation. Screwdriver attachment. Slide the T25 polyaxial driver down the tulip to engage the shank. Once seated, thread the driver into the tulip by twisting the knob on the proximal end of the driver. If the screw has been seated properly, the crossbar will be flush with the tulip. If the crossbar is not flush, it will look like this. Screw insertion. If the serial dilators were utilized, the screw can be delivered through the 18 mm dilator. If the tap dilator was used, the screw will be placed over the guide wire and advance through the skin to the bone. Advance the screw under fluoroscopy to confirm proper trajectory. Once advanced to the desired depth, release the screw from the driver by twisting it counterclockwise on the knob. Guide wire removal. Once satisfied with the placement of the screw, remove the guide wire using the wire distractor. If needed, a mallet can be used to assist in removal. Screw adjustment. The screws can further be adjusted using the T25 adjustment driver. This allows the surgeon to further sink a screw or back it out to restore the tulip's full range of motion. Once the desired screw height is achieved, adjust the tulips using the tulip manipulator. To do this, orient the head adjuster to the opening of the tulip and slide into place. Now rotate the tulip so it is prepared to receive a rod. The rescue tower guide can also be substituted as a head turner. Rod measurement. Now place the rod caliper into the furthest cranial and caudal tulips. Rod length is read from the top of the caliper. Make sure you fully seat the caliper in the tulips. This can be verified with the laser etchings on the rod caliper. The black line should be nearly flush with the extended tab tulips. Once a rod is selected, it can be further bent using the rod bender. Prior to rod insertion, a path through the soft tissue can be cleared by the tissue cutter. This will make it easier to pass the rod between the tulips. Rod insertion. Attach the rod to the rod holder. Lock the rod into place by twisting clockwise on the gold knob. The black laser etching on the side of the rod holder will help you determine when you are in the lock or unlock position. If more force is required to lock or unlock the rod holder, the adjustment driver can be used to twist the gold knob. Once the rod is attached, it is then passed through the tulips. There are two different rod holder options, a pass-through and a non-pass-through. The use of one versus the other is dependent on surgeon preference and technique. To confirm the rod is passed through each tulip, use fluoroscopy. or the rescue tower guide. If the marker on the guide is level with the top of the tulip, the rod is not in the tulip. When the marker is well above the top of the tulip, the rod is seated within the tulip. You should also confirm using fluoroscopy that the bullet end of the rod and the non-bullet end are positioned outside the tulip. Locking screw insertion. There are two driver options for lock screw delivery: the T30 threaded lock screw starter and the T30 lock screw starter. The difference is that the threaded option allows for more reliable retention of the lock screw. The screwdriver is a self-retaining driver with no threaded component. The threaded option is more useful for removing set screws, while the lock screwdriver is better for initial delivery of the set screws. Note the indicators on these drivers to confirm full reduction of the rod into the tulip, the laser etching on the threaded lock screw starter, and the final taper on the lock screw starter. These indicators should be flush with the top of the tulip to confirm satisfactory reduction of the rod. If the rod and set screw are not fully seated in the tulip, the laser etching and taper will be above the tulip. This will result in the set screw being above the tab brake. Rod reduction. In addition to the 20 mm of reduction built into the CTMIS tulip, an additional 30 mm of rod reduction can be achieved with the reducer sleeve and driver. Line up the black arrow on the sleeve with the open side of the extended tab tulip. Place the sleeve over the extended tab and slide the gold collar down to lock it in position. Next, load the set screw on the reduction driver. Now lock the reducer rod in position. Advance the reduction driver down the reduction sleeve and extended tab. Rotate the palm handle clockwise until the center knob bottoms out completely against the rod reducer sleeve. To deliver the set screw, pull up on the egg handle and rotate the driver pins to the black divots. Rotate the egg handle clockwise until the set screw is fully delivered. Compression, distraction, parallel assembly. Place the parallel compressor distractor, which is silver, over the final tightened extended tab tulip. The parallel compressor distractor, which is gold, is placed over the tulip that has not yet been final tightened. The gold compressor distractor handle knob fits into one of the two connection slots. Now slide the short torque driver into the final tightened extended tab tulip. Then insert the long torque driver with the torque limiting handle attached through the gold compressor distractor handle. Now compress or distract as desired. Once the desired compression or distraction is achieved, final tighten the set screw. Compression distraction, medial lateral assembly. Place the silver pivot over the tulip that was final tightened, then slide the gold compressor distractor handle over the tulip that has not yet been final tightened. Now the medial lateral handle can be placed on the pivot opposite to the compressor distractor handle. During assembly, be sure the gold handle and silver pivot are engaged with each other. Place the short torque driver down the silver pivot and the long torque driver with the torque limiting handle down the gold handle. Compress or distract as desired. Once the desired outcome is achieved, final tighten the set screw. Final tightening. Assemble the torque limiting handle to the short torque driver. The counter torque can pivot by pulling back on the gold plunger. Make sure the black laser etching is lined up with the tulip opening. Now slide the final tightener assembly down the extended tab tulip. Rotate the torque limiting handle clockwise until an audible click is heard. This click is verifying the final torque of 90 inch-pounds. There's a second counter torque option. The full-length counter torque wrench will slide over the entire extended tab, and the scallops on the distal end of the counter torque will seat on the rod. Extended tab removal. Utilize the ring remover to break the closed ring. Align the black line on the ring remover to the open side of the extended tab tulip and rock towards the closed part of the ring. Press the gold button to eject the ring. To break the tabs, align the black line on the dual tab breaker with the openings on the tulip. Advance the breaker over tulips and rock medial to lateral. Repeat this process for the remaining towers. Tower rescue. If any of the extended tabs break prematurely, rescue towers are provided. Begin by sequential dilation with dilators 1 through 3 to create a path to the tulip. Now remove dilators 1 and 2. Fully seat the tab end or post end of the rescue tower guide in the tulip. If the lock screw is present, the post end should be utilized. Remove dilator 3 and slide the rescue tower over the guide until it securely engages the tulip. Pull on the rescue tower to ensure it is secure. The rescue tower is directional. The laser marks on the rescue tower must align with the marks on the tulip. These markings cannot be observed during the procedure. If you're struggling to attach the tulip, twist it 180 degrees and try again. Once attached, all system instruments are compatible with the tower. To remove the tower, slide the removal tool down the rescue tower. Make sure the laser markings align with the slots on the rescue towers. Press the gold button to engage with the rescue tower and gently pull up to remove.